microphone will be muted during the presentations, and you can use the chat box for your comments and inputs, questions. We ask you to please share your name and your affiliation so that we are able to share those messages with the moderator. During the Q&A session, you could contribute either by using the chat, but also by raising your hands. And we will then be able, once the moderator give us the go, to open your microphone. Please note also that if you are joining us using a smartphone device, a mobile device, quality of audio may be very poor. We apologize in advance if for some reason we have to cut your mic and not be able to hear you until the end. And in that case, please feel free to use the chat, and we will be happy to share your questions or remaining inputs with the moderator. I will also ask you, if you are new in this webinar, if you're joining us for the first time, to please register to our newsletter. That will allow you to get the content of this presentation that will be sent via our campaigns, MailChimp campaigns, but also to get informed about all of the future events that Academia 2063 will be hosting. So today with us, we are pleased to have Dr. Greenwell Machaya, who is the Senior International Research Economics at International Water Management Institute, and also the research coordinator for Southern Africa. Greenwell Machaya will be our moderator for today. We also have as presenter Paul Gutika, who is Senior Policy Analyst at the International Livestock Research Institute, and Leonard Kiroi, who is Research Officer at the International Livestock Research Institute. I will now hand the floor to Dr. Machaya, who will be briefly introducing our presenters, and we thank you very much for being with us today.
Thank you very much, Nabu. And thanks very much for everybody who is listening in or attending this session. We don't take your time for granted. And my job today is kind of relatively easy because I'm simply going to moderate this session titled Assessing Community Vulnerability to COVID-19 in Kenya, a Spatial Outlook. The presenter, as already introduced by Nab, is Dr. Paul Guthiga, and he did this work with his own colleagues, so he's going to say who those are. And the housekeeping rules have already been given by Nabu in terms of how you raise questions, etc. I will be attending to the dashboard to also help see who is raising questions after the presentation has taken place. For now, I should therefore just now have the pleasure of inviting Dr. Paul Guthiga to give us the presentation, and then we take it from there. Dr. Paul Guthiga, this is your turn. Please give us a presentation. Now we can remind us how many minutes. I think you're the one who is going to be keeping time, right? Reminding us of time, etc.
Yes,
over to you.
We will help with the time.
Okay, fantastic. Over to you, Dr. Paul.
Okay, thank you very much, Greenwell, and thank you, Nabu. Good afternoon to people joining from Eastern Africa. Maybe good morning to those joining from West Africa. Hello, everyone. We are very pleased that you have set aside time to join us in this presentation. Let me share the presentation. Okay. Sorry. Let me put in the presentation mode. Mr. Moderator, can you confirm that you can see the presentation?
Yes, I can see it. And I think
Okay.
you're ready to go.
Yes, indeed. So, all right. So the title of our presentation is Assessing Community Vulnerability to COVID-19 in Kenya, a Spatial Outlook. This study was done by the four colleagues listed there, myself, Leonard, who also will present part of this work, Joseph Karogia, who is the coordinator of research in ECA, and Mohammed Ahid of academia. So in terms of the outline, I will basically do an introduction, say something about the methodology we applied. We will give you the findings, the conclusion from those findings, and what we think are the implications. So I think all of us do know that with the emergence of COVID-19, the issue of disease and disaster governance has gained currency as a public policy concern, because this pandemic has spread worldwide and has affected individuals, community, even national and global economy to varying extent. And therefore, effective and efficient response to this pandemic requires that resources be directed to the most vulnerable sections and areas. Because from what we already know, while the pandemic is affecting, is a global one and affecting nearly everyone, there are certain areas that are more exposed because of underlying situations there, infrastructure, health, food security, access to health, etc. And to be effective and efficient in responding to it, then data and evidence come in. And therefore, that is why we have these studies. And where resources are limited, you want to prioritize the most vulnerable communities for whom the effect of the pandemic are likely to be proportionately more devastating. You want to ensure that you proactively invest so that they are not affected. So the vulnerability, as we are using it in this study, is the propensity of an area to be exposed to the spread of COVID-19. That's the first thing. And then we combine that with the capacity to control it and care for the people that would become infected, and also the high exposure to negative food security impacts. So, I mean, we are looking at several things combined. The propensity first to be exposed, capacity to control it, and also care for the people that are infected, and also how that pandemic is likely to affect the food security of those people. And we also know that certainly vulnerability is not geographically uniform. If it was, then this study would be mute. So the study focused on differentiated spatial vulnerability using an overlay of indicators, a group that is related to food and nutrition security, another category related to disease burden, health infrastructure and outcome, and also population density. Allow me now to quickly take you through the methodology without delving much into the details. First, we use the 8 regions of our country, Kenya, because first, this was informed by the main data set that we use, which is the DHS survey data of 2014 that used this classification. I think for people living in Kenya, in the current dispensation of devolution, we know that counties are actually a very important centers of governance. And probably that's something that in the future would be important. But I think given the data that was available, we think the information is very important also because we know that there has been effort by counties to form regional economic blocks to actually deal with these issues that affect them across counties, for which an individual county may not do it. So, and therefore we are saying, much as we are using the 8 regions, they largely coincide to the 6 regional economic blocks that has been formed by these counties under the new governance structure. So we considered various data sources and also variables, and here we present what we used. So the prevalence of stunting from the DHS survey of 2014, and that is an important indicator of the health status of an area. We use the prevalence of diabetes because we have since learned that this is one of the predisposing factors. We also looked at the prevalence of high blood pressure, which is also a predisposing factor, if you like, for the serious cases of COVID-19. We also considered 2 variables that are health related, the proportions of females that get assistance from doctors, nurse, or midwife from the same data source, DHS, proportion of females, 15 to 49, for whom distance to health facility is a big problem. The other one is food expenditure per capita, where we use the Kenya National Bureau of Statistics, the statistical abstract of 2020, proportion of persons over 50 years based on the population and housing census that was conducted in 2019. This is also another factor. We are told that people of a certain age become more predisposed to the serious impacts of COVID. And then the other last one is on the density of inhabited areas, that is population density. And this data is based on the population and housing census of 2019. So how did we compute the vulnerability? So we have vulnerability for each of those indicators that I have described. But it's also important to say that this vulnerability was being computed relative to the average, and therefore it is like comparing regions based on the national average for that indicator. And therefore we were classifying, sort of constructing the z-scores using the mean, and then looking at how far the indicator for a given region is based on standard deviation. And as you can see, we have 4 categories. So for indicators for which less is better, for example, the less the cases of diabetes, the better the situation. So this is the classification that we have. We have those 4 categories. For other indicators for which less is worse, think of a situation where we talked about access to health. So you want more people to access health, and therefore you have to construct the vulnerability indicator slightly differently, although we are using still the mean and also the standard deviation to construct those 4 categories. So then based on those computation and then of course we now computed the overall or the composite vulnerability index, where we were summing up all the indicators based on the formula that we have described there, where K is the number of indicators that are included in the analysis, and of course the W LIJK is the weight associated with the rank based on the category that we talked about. So then we were able to get the scores, and we used those to map the areas, the 8 areas that we mentioned. And now I will be handing over to my colleague, Leonard, to take us through the findings based on our analysis. So Leonard, over to you. I will be muting myself.
Okay. Okay, thank you very much, Paul, for that introduction and explaining the methodology. So we'll go straight away to look at the results of this study which we did for Kenya. So as explained by Paul, we considered a number of factors. We have among them food and nutrition security as one of the factors. And under these, we have 2 indicators which we have used to measure these. One is stunting, and the other one is the food expenditure per adult equivalent. So for this one, I think we have indicated that it is in USD, but essentially it is in Kenyan shillings. So looking at the results for the food and nutrition security factors, when you look at stunting, the prevalence of stunting is quite high in a number of regions. So we are talking about 8 regions, and we have Eastern, Rift Valley, and Coast. Those are the regions which have recorded the highest levels of stunting. And these are the regions which are much more vulnerable to the effects of COVID-19. Now, when you come to food expenditure per adult, the region which is more vulnerable, the regions which are more vulnerable is Northeastern and Western. However, when you look at these 2 results, or the 2 maps here, you find that there's quite a marked difference between the 2 nutrition and food security indicators. For example, when you look at Northeastern, between the 2 food security indicators, they don't show the same trend. And what you are saying here is that in Kenya, issues like stunting is not like directly associated with poverty levels, because it is influenced by other set of factors. For example, dietary diversity, feeding, caregiving practices, maybe things to do with access to adequate sanitation, and even disease prevalence. So that explains the difference in the prevalence of these food and nutrition security indicators. Next. Okay, so we also looked at the health infrastructure and access indicators. And for this, we used also 2 indicators to measure health and infrastructure access. So we looked at the proportion of women who are aged 15 to 49 years, who reported that the distance to the health facility is a major problem, as well as the proportion of women who are aged 15 to 49 years, who reported that they had received assistance from a doctor, a nurse, or a midwife. So for the health infrastructure and access indicators, we see the similar trends in both of these 2 indicators. So Northeastern, the northern part of Northeastern Kenya is much more vulnerable or they are at much risk of getting infected, and even the consequences of COVID-19 compared to the national average. So the regions around Central and Nairobi are much less vulnerable. When we look at the disease burden indicators, so for this case also, we have two indicators which we selected for this. We have the prevalence of high blood pressure and the prevalence of diabetes. So these are mostly these are pre-existing conditions among the health of individuals. So this one shows that the Northeastern region shows some differences again in terms of the two indicators. In terms of high blood pressure, it shows that it is much less vulnerable. But when you come to look at the prevalence of diabetes, in Northeastern, it is much it's much less vulnerable. But when you look at the high blood pressure, it is much more vulnerable. So the region, for example, Northeastern, it has a high level of vulnerability and at a higher risk of COVID-19, but is less vulnerable with respect to issues of diabetes. The other region, like Central, is much more vulnerable, like the prevalence of diabetes in Central and Nairobi is high, and therefore these regions are at a more higher risk when you consider issues to do with disease burden. Next. Next, okay, demographic structures. So this is another factor which we considered. So for demographic structures, the Central, Nyanza, Western, and Nairobi regions are the regions which are much more vulnerable to severity of contagion and consequences of COVID-19. The rest of the region are less vulnerable, mainly due to low population densities in these regions. So having looked at that, we constructed the overall, or what we call the composite index of vulnerability to COVID-19. And when you look at the composite index, we see that the region with the highest, which is most vulnerable, is the Western region. Now, when we consider all these factors together, so the highest vulnerability is Western region, followed by Nyanza and Northeastern region. So the areas of the central part of the country in Nairobi are much less vulnerable compared to the national average. Next. So in conclusion, what are we saying? So we looked at this vulnerability of the 8 regions with respect to food and nutrition security. We looked at the health infrastructure factors and demographic factors. And in this case, the vulnerability indices showed that there's quite widespread inequalities across the regions of Kenya. And these factors are most likely to raise the probability of for allocation or for people or communities in this region to suffer more severe effects of the shock of COVID-19 pandemic. So we are saying that the regions which are at higher risk of infection and spread are northern, western, and eastern parts of the country, basically because as these regions, they have like poor access to food, things to do with health infrastructure are not well developed in these regions, as well as when you look at the health outcomes in these regions also, they have like poor health outcomes. So as we said, we found out that the least vulnerable regions are mainly located around the central part of Kenya and Nairobi, basically because they are more endowed in terms of these resources. So what does this imply? What does this imply? Okay, for the government of Kenya and the stakeholders, this information is very useful. So it is useful in guiding some of the interventions, especially in the short term. However, we think that there is also need to reduce inequalities in the long term, even beyond this current COVID-19 pandemic. So it is very important that we prepare for future pandemics and any other health shocks that may be inevitable in the future. And it is also very important that we implement policies that reduce vulnerability to shocks in future. Next. Yes, so I think that is the end, Paul, of our presentation. We now welcome questions from the participant. Thank you very much.
Thanks very much, Leonard Kirui, as well as Paul Guthiga, for the wonderful presentation. I think this is really interesting work that you're doing. And yeah, so I think before I open the floor to the audience to ask questions, maybe can I also just try to understand more, given that this work is important and it seems to be data intensive, and you also talked about the demographic health surveys, and you also explained why you analyzed it at different levels rather than other levels. So what kind of data challenges did you maybe meet while conducting this study? If you can just tell the audience in brief, and were there any lessons that we can take from how you solved them? Over to you, the presenters, Paul and Leonard.
Okay, thank you very much, Greenwell, for that question. Yes, indeed. I think as we all know, as researchers and people who do policy analysis, getting the right data and the most current data at the right level or scale and current enough is very important to inform policy decisions. So first, for us, as I indicated, we relied mainly on the demographic health survey that was conducted in 2014. So for most of the indicators, so we are talking about data that is like 6-7 years old. I think that is one challenge. I think more current data would be probably be more helpful in speaking to the current situation. But we were also lucky that the 2019 census data was also available. And remember, these census data for most countries, Kenya included, they come out every once in a decade. So it happened that we had the most recent survey, a census done, and that data was available. So I think, therefore, the question of having the most updated data, I think is important. And maybe I will say something about that when I'm talking about the second point. The second point is the scale at which the data was available. Since 2013, we have, where devolution came into effect in Kenya, we have new administrative and governance units called the counties, 47 of them. And therefore, we would have probably wished that we had this data at the county level. But the DHS then was, done to project outcomes at a higher level, at that regional level. But I think one positive thing about the data in Kenya, the counties now, with the assistance of the Kenya Bureau of Statistics, are preparing the county abstracts. And I think this will become important. The scope of the kind of data that will be included could be expanded, but I think that will become important. in being able to talk about the implications at that administrative or governance level of the county. Those, I think, are the challenges, but again, I think there is light in the sense that the country is already doing something about that going into the future. Thank you. On that, that's on the issue of the data.
Great. Okay, so thanks very much for that explanation, Paul. Yeah, data issues, I think, are a challenge, and it's good to hear that there are some advances in Kenya in terms of new data coming in with the census. I think going forward, because I know that you guys are always doing research, that should be something you can consider. You need to take advantage of that. But again, on the issue of the many good things that I've seen in your research, one of them is the fact that I think you have chosen the indicators to use in the community vulnerability so well, because I think they're encompassing issues of nutrition, because predisposition to poor nutrition, it also predisposes you to other problems, and as well as distances to health services, population, etc. So that's good, obviously. But if I was a policymaker, Paul, and Leonard, I would maybe not have time to hear everything about what you're saying, although it's of interest to for me on the other hand as a researcher. But if I wear a shoe of a policymaker and I don't have enough time, and I just ask you, so Paul, would you please tell us what are the key, maybe three or four key indicators that you think contribute more to community vulnerability in Kenya? That such a question cannot be unthinkable. Think about a case where we have limited resources and we want to do something. We would want you to be ready with those ones. Would you be able to advise? Over to you, Paul, and
okay,
Leonard.
Yeah, thanks, Greenwell. I'll say something and then I'll invite my colleagues. So, what should policymakers do? So I tried to look at these indicators and do a simple count for which of these indicators are different regions made more vulnerable. And I picked one, population density. And I think that already reflects what we know about the epidemiology of the disease, that where people live more closer to each other, the epidemiology of the disease is such that increases the risk or spread of the disease between people. It is no wonder that the county of Nairobi over time has been recording the highest number of cases of COVID-19. So I think first, the efforts of containment and control of disease have to focus very seriously on areas where the population density is high, okay? Major cities, like Nairobi, areas, say, of Western Kenya, where also the population density is high. I think that becomes important. And I think already the policymakers in Kenya, coming maybe more from the epidemiology of the disease, are already doing something like that. For example, controlling the movement of people, controlling the interaction of people by requiring people to keep social distance, requiring that certain meetings be not held, or if at all, by fewer people keeping social distance. I think is an important element, population density. and really the entry point there is management. How do you, it's not making areas less dense, but how do you manage a disease in situation of high population density? Incidentally, I also in my count found that stunting was also one factor that was making many regions vulnerable. Now, stunting is now a long-term issue because it's not something that can be resolved in the short term or quickly, but measures need to be put in place, especially on educating people about dietary diversity, issues of sanitation, because as Leonard mentioned, when we mapped stunting and then tried to compare the regions by poverty indices, it wasn't mapping one-to-one. But I think the issues of the health status of people need to be taken seriously going into the future, given that this is one pandemic, we don't know how many others will be coming into the future. But those would be my responses. But Leonard is here, Joseph is here, so if they have additional comments, I welcome them.
Yeah, sure. Go ahead, Leonard or Joseph or Muhammad, if you're here.
Okay, thank you very much, Paul. Maybe I'll add something on stunting. Looking at the maps, just by looking at the just visual maps, you will see that the stunting was like most of it was red for most of the parts of the country. So which shows that this is one of the serious issues we need to look into. The government of Kenya has tried during when there was emergence of this COVID-19 pandemic. They introduced some social safety nets, and particularly this is very important, more so to the people who are elderly, whom we try to look at. Like in this study, we were looking at people who are age 50 and above. And I think it is very important to ensure food security and nutrition for these vulnerable groups, because these are the people who are at the higher risk. So it is important to enhance things to do with social safety nets for these people, and even in the northern or the farmer, like people who are away from the city, because as we looked in this study, those are the people who are suffering most, who are most likely to suffer from the consequences of COVID-19. So as every day as the government reports about the infections, they do it in terms of the regions also. Quite often, you will find that Nairobi or the central parts of Kenya, the ones which we indicated that they are less vulnerable, they are less vulnerable. But if regions like northern Kenya and western were exposed to the same level as Nairobi and maybe central, then the consequences will be the consequences will be very severe. So it is very important to look at these food and nutrition factors so that you can maybe reduce the unforeseen consequences of the spread of this disease. Thank you.
Dr. Machaya, just to perhaps reinforce
Yeah,
that
go ahead,
message.
Dr. Kaluje.
Thank you. The issue of food insecurity is really important. And if you look at stunting, it's an indicator of chronic food insecurity. So people over long periods of time have not had enough food, and so they consistently lack food, and that's an important predisposing factor. So there is already a lot of work that policymakers can and should do not just for the pandemic, but also in the long term, because it shows that it's an indicator that is pointing to failures in different directions, making food available, the right food available to people, and of course the consequences of chronic food insecurity are clear to all of us. Um, uh, Cognitive, abilities, education, skills, and so on. So it leads to many other different things, and should draw the attention of policymakers. Thank you.
Thank you very much, Dr. Kaluja, Paul, and Leonard. Okay. At this point, Nabu, is there any other question you might have received from the chats? Just in case I can't see them.
Yes, we also have a hand that is raised.
Oh,
So
okay.
it will be up to you to let us know, and we will.
Let's start with the hand, if it's there.
Yes, the hand is there. Can
Okay.
the technical?
I can't see the hands for some reason here. Yeah,
Okay.
so but it's fine. Yeah, as long as you see them, you just let me know.
Yes. Okay. So please, Babaka, can you unmute the participant that would like to speak?
Over to you, Babaka.
Hello, hello, hello.
Yes, go ahead, please.
Yeah, my name is Anisha Chichibuzo. Yeah, I'm attending the webinar from Belgium, from Brussels, and thank you very much for this. Exciting topic and your research, which I think really contribute to more insight in mapping. Yeah, the vulnerability to COVID-19, and here, especially in Kenya. I really would like to thank you for what I'm hearing. Actually, I just wanted to contribute in terms of methodology, and my thinking is that, given that you used means index and standard deviation to calculate the vulnerability index, right? Here, you know that means is known to be a biased estimator. Why? Because it is really sensitive to extreme values, distribution, that kind of things. So I was wondering whether it would be more robust using non-parametric, estimators such as median and the related interquartile range to, that the contribution in terms of reflection I wanted to add to your research. Would you provide any response for that if possible? Thank you.
Okay, so do we take another question and then you can answer them together, or is that should we say? So I think in this case, let me add another question which I've just found here, and maybe you can answer them together. The other one is from Jessica. She says, have you assessed your findings against the current prevalence reports? What informs the disparities? I guess she wants to find out what informs the differences across the analysis units, locations you're talking about. And for Chibozo, I think you got it, is trying to find out where the use of the mean might mean that there might be some bias there because the mean is sensitive to outliers. So you please address us. So whether you dealt with outliers before analysis or whatever, the ball is in your court. Paul, Leonard, Joseph, thank you. Over to
Okay.
you.
Yes. So thank you very much for the questions. Thank you, Chibozo, for appreciating the work that we are doing. I appreciate the question on the methodology and the use of the means and whether or not the mean might not be a biased estimate. So first, the challenge we have here, if you think of it, remember we are dealing with 8 regions in the country. So for each of these indicator, we are talking of 8 data points. Therefore, that sort of limits us in terms of using another measure like the mean, I mean the median that you have proposed. I would imagine that if we were using, we had disaggregation at the county level, which are 47, probably would have a bit more flexibility in terms of can we use the median or maybe another measure. But again, the other point that we are trying to sort of deal with that problem is that much as we are using the mean, we are trying to address that problem by sort of creating, if you like, a z-score based on how far a region's data point is either to the left or to the right of the mean by the standard deviation, and therefore, yes, there's still some element of bias, but remember, really it's comparing one region relative to the other region, and I think there is merit in that because as a policy maker and as a government that is in charge of the whole country, you want to worry about areas, certain geographical areas within your country that might be a bit more vulnerable to COVID-19 based on a certain indicator relative to the others. But I think, I'm sure our colleagues, Julie and the others, if they are here, they may have something else to say about the methodology. But I think the points that you raise are quite important. And maybe going into the future, we can explore what else we could do or what other methodological improvement we could make. But we believe this is a good start. Maybe before I invite in my colleagues, let me address the question by Jessica, who is asking how our findings, whether we are our findings against the current prevalence report. So I think so what I would say, we are aware and we have data on the current prevalence numbers across the counties in Kenya. But I think it is important to look at this study a bit differently. This is slightly different from saying that where do we expect the most numbers of COVID-19, but we are looking at using a combination of factors, which area is likely to be, for example, if COVID were to spread all over the country, given the underlying health infrastructure, the health of the population, the access to medical facilities, which areas are likely to be more vulnerable. So it's somewhat different from looking at the current numbers, because the current numbers, I think, are driven by several factors. Of course, we know that the county of Nairobi has the highest population density. I think the first case of COVID was reported in Nairobi, and the number of cases in Nairobi has been sort of the highest. And as I said, that is informed by the epidemiology of the disease, how it is spreading from one person to the other, so that where people live very close to each other and are interacting closely, the likelihood of disease moving from one person to the other is much higher. And therefore, we see a lot of many cases in Nairobi. But when you look at other factors, the vulnerability of the city of Nairobi to the disease is ameliorated by other factors, if you like. For example, there are more hospitals in Nairobi compared to, say, in Northeastern, in Wajir or somewhere else. So, and therefore, it's like we are looking at the same problem from a different angle, that if the disease was to spread everywhere, which areas would be most vulnerable? But we are not, it's not a one-to-one mapping with the current trend in terms of numbers and where they are happening. This is to inform the policymaker how he should deal with the problem now and into the future. Should another disease that maybe spreads in a different way and it's likely to affect the whole country, which areas would be most vulnerable, and how do we deal with that, and how do we make the most vulnerable people more resilient or more able to deal with the effect of the disease? I've used many words, but I was trying to distinguish your question and the analysis that we did. So may I now invite Leonard and Joseph to clarify and respond to those two. And if Julie is online, she could also speak to the methodology. Thank you.
Thanks, Paul. I can say something quickly about the question by Jessica. The patterns of the disease that we have observed, I think, support the finding that where population density is high, you are likely to have more cases, and the map shows that. I think the map where we are showing vulnerability due to the demographic factors shows Nairobi, Central, and Western Nyanza areas are likely to have high high prevalence rates. Perhaps what's missing is Mombasa, but that's because the numbers in Mombasa, given the regional nature, we are looking at the coast province rather than Mombasa. Probably if we had more disaggregated data, Mombasa would show up as well. So there are no disparities. Remember, vulnerability is defined in a multidimensional way. We talked about propensity to be exposed, which is one of the set of factors. But then we have limited capacity to control the pandemic and provide care. And the other one is the exposure to negative food security impacts. So, yeah, thank you.
Okay, that's very good.
So, Greenwell.
Okay, do we expect another one? Okay, over to you.
Yeah.
Paul?
Yes, I'm told Julie is online. Maybe she may want to say something on the methodology.
Mr. Moderator, we also have another question. So maybe after Julie, I'll post the question to you.
Okay, not a problem. Julie, go ahead, please.
Hi, Greenwell. Thanks for giving me the floor, and thanks, Paul and Leonard, for the presentation. I'm Julie Collins. I work with Academia 2063, which is based in Rwanda, and we have been carrying out similar vulnerability analysis for other areas using the same methodology. So I can just quickly add, in terms of the mean, that we do make an attempt to eliminate outliers. If we see something in the data that seems to not make sense, then we eliminate that number from the calculation of the mean, and then we still include that area in the vulnerability calculation, but we substitute a more reasonable value in terms of ranking that area, but we don't use its value to calculate the mean. So hopefully that will help with the sensitivity of the mean to outliers. But agree with what Paul said, that we can keep looking into different ways to handle that issue. And I also wanted to add something about the question on the findings reflecting current prevalence reports. So again, as Joseph said, the index kind of is reflecting several different things. So not only the susceptibility of an area to the spread of COVID, but also the ability to care for patients and the potential food security effects. So we wouldn't expect it to see reflected very closely in just the case prevalence. And I was taking a look during this presentation at the Kenya Health Research Observatory's COVID-19 tracker. I can put a link to that in the chat a little later. But it was very interesting because there's a map showing the fatality rates by county. And even though those are at the county level rather than regional, those case fatality rates actually reflect this index much more closely than does the overall prevalence rate. So I think that speaks to the fact that this index incorporates also what are the likely impacts of an area if they do get COVID. So the northeastern areas, the northeastern region, even though they have a lower prevalence, they're much more vulnerable when COVID happens. They have much higher case fatality rates than many other regions do. So it's interesting to look at the different measures, I suppose, of how COVID is affecting an area. And as we move forward with this analysis, we were thinking, and we can discuss it with Paul and Joseph and Leonard and your team later, we might want to think about having 3 sub-indices, one on vulnerability to the spread of COVID, one on ability to care for infected patients, and one on food security impacts, which we could look at separately or look at together, depending on what we or our audience is interested in. So we can discuss that a little bit later as we move this research forward. So thank you.
Okay, thank you very much. All right, so Nab, then you said there was someone else. Please, would you read the question or let me know which one is it?
Yes, it's from Ms. Nancy Leibuni.
Oh, from Nancy. Okay, so I can read it here. Says, thanks for the insightful presentation. Are there positive outcomes regarding food utilization and availability as a result of the pandemic that can inform the subsequent data collection? Please remind participants that they should share. Okay. Their affiliation. Okay, but I think that's another. So the question here is simply, are there positive outcomes regarding food utilization and availability, I think, and vulnerability maybe, or as a result of the pandemic? I think if the one who has posed this question is there, they can also feel free maybe to just speak if I'm not reading properly here. So over to you, Joseph, Paul, and your team.
Okay, so thank you. Thank you, Greenwell. So maybe Nancy, if you are online, I believe you are, can you expound on the question? So, because you're asking whether there are any positive outcome regarding food utilization and availability as a result of the pandemic. Maybe you can clarify a bit, Nancy, please.
Thank you very much. My clarification is that during the pandemic, we've had measures such as lockdowns, and we've had curfews. So most households are now tending to cook a lot of food and not buying it from outside. And at the same time, we have had initiatives to promote kitchen gardens. So that's where I'm coming from. I'm thinking there most probably will be some positive outcomes in terms of nutrition for households because of the containment measures that have been put in place as a result of the pandemic. So I was just wondering if we could have suggestions for areas that data can be collected or additional, because I know then the Bureau would be going forward to collect some data. They have certain waves. They've been collecting the data on COVID wave data, but nonetheless, going forward, is there a way we can make sure to account for the positive externalities that happened as a result of the measures for containment of the virus? Thank you.
Okay, so all right, thank you very much, Nancy. I think it is clear. The question now is clear. So I think from this study, we may not be able to respond to that question really directly because we didn't look at it. There's another stream of work we are doing on the impact of the pandemic and the restrictions that have come with it on prices. But we haven't gone to the extent on understanding the nutrition impact and utilization. So I think it's an open question, and certainly any data that can be collected to answer that question, I think would be most welcome. So maybe we can engage that further. But I think from our study, we didn't go that far. Unless there are other colleagues within the academia. I know there are those who have done something on production disruption and also the impact on trade, but I'm not sure they have gone to the household level to understand how the pandemic is affecting food utilization and availability. My colleagues can come in.
Okay, thank
Go ahead,
you very much.
Leonard.
Yeah. Just briefly, maybe I can say, in terms of the positive outcomes, I think we are yet to see that. But I think the government of Kenya has put enough efforts, even like they have enhanced their data collection. If you look at the ministry, I think they convened something they're calling it the food security war room, and they're involved. I think they convenes twice a week. I don't know if they still do now, and they do meet to tackle a number of emerging issues. Particularly, they look at the food availability, market access, input, and even food prices. So I think as we move forward, I think due to the emergence of the COVID-19 pandemic, the government has enhanced data collection in some of these factors. So I think going forward, because initially we know data was an issue and I think they are doing it at the county level. So there were quite a number of meetings they were doing very often. And I think moving forward, we expect that such kind of information will be able to help us to access some of these positive outcomes, so to say, yeah, in terms of looking at this pandemic. So that is it. Thank you.
Thank you very much, Leonard, as well as Paul. Can I also just ask one question here? So one or two questions, but let me see. So for these community vulnerability that you have computed across Kenya, is there, I'm not sure whether you responded to this question, but is there a way that you would be able to pinpoint at, say, maybe 3 priority policies which you think might be useful in trying to protect the communities? So can you tell me any public policies which you think might be very effective in terms of reducing the overall vulnerability? So I know that there are many indicators of vulnerability, there are many sub-indicators there, but you have also computed the community level one. And presumably at the policy level, it's possible that there are some things that the government can easily do. So if, for example, someone was asking you in Kenya, what would be those policies you might think they should consider? I hope I was clear there. So over to you.
Okay, thank you, Greenwell. Yes, you are clear.
Okay,
the question is clear. Yeah, so you sort of asked that question, but differently, because I think you asked among all these indicators that we considered, which came out as being the most important in determining community vulnerability. And I see this question as the flip side of it, because then the question is which policies would be most effective in reducing community vulnerability to a disease like COVID. So, so first, based on the mapping that we did, I mentioned population density as being very important. The number of times that areas were labeled as more vulnerable because of the high population density was quite high, and also stunting. So I think, so in terms of the policies that government can do, I see it the short-term one, because when a disease like this comes up, it is highly infectious. It can have very high fatalities. Therefore, some very immediate measures to contain its spread become an important policy response. Okay. And I think what we are observing from government in Kenya is very much in line with what I think we would recommend. For areas that have high population density, I think restrictions and measures to control the spread of that disease from in two ways. Within that area of high population density, but also preventing that area from becoming the epicenter of spread, you have to come up with containment measures. I think the government from the very start, the onset of this pandemic about 1 year ago, they were moving in that direction. For example, the first restrictions in movement from Nairobi to other areas and Mombasa was actually in that line. And I think this has become sort of a global practice. I mean, we hear of lockdowns in Europe, in other places. So you lock down areas that have become epicenters of the disease to prevent the disease from spreading to that area to other areas, but also restricting movement among people within the area also prevents, how can I say, sort of the horizontal from person to person spread of the disease. But again, I think the caveat to that is that when you implement those restrictions, based on other studies that we have done, especially the one on impact of prices of food commodities, it is very important to keep the corridors of flow of essential goods, essential services, and like food to continue flowing. Otherwise, you end up hurting the same population that you are trying to protect. So food should flow freely, at least ensuring that as it flows, there's no risk of spread, but at least food should reach those populations. And also other essential services, people should be able to access them. But I think restricting movement, restricting interaction, especially in densely populated areas, I think is an important policy measure. The other one, which is more long-term, is what Joseph was addressing there. Stunting is why we chose stunting. I remember in the earlier discussion when we are thinking about what measure of food or nutrition security do we bring that actually encompasses something that is more long-term, that is not so transient as in, for example, underweight, because of a certain period when food is not available and therefore there's underweight, which is very transient. When food is available, it changes. But something like stunting already tells you this is a reflection of problems of food insecurity and other health-related issues, the knowledge issues, awareness of food diversity, awareness about sanitation and other things. So I think that is one policy area within the bigger policy action by government to ensure that people are food secure, by ensuring that food is available, but also increasing knowledge about its utilization, about diet diversity, about sanitation, and other things that would ensure that the population is generally healthy, because healthier people are better able to deal with diseases, whether they are a pandemic like COVID-19 or any other. So I think I would pick those two in Kenya in particular as areas that require urgent policy measures. My colleagues could add.
Okay, thanks very much there. If there's anyone in the group who with anything further to this, that's your turn, you can come in. And for those with questions, you can keep writing them here on the chat. And please also feel free to tell us where you are from, just like the colleague in Belgium did. So I feel like I've lost an opportunity to know where Nase Laibun is from and is calling from. So if there's an opportunity, Nase, you can write in the chat box as well where you are from. So I am a moderator, but it was interesting also to see the question from Nase on the interface between food utilization and the availability under the COVID, whether there are any positive outcomes. Yeah, so obviously you answered very well, you guys. But I was also just thinking. So Nase, for at least for my knowledge, maybe this work might not necessarily show that, and I think there is a scope for doing something at the micro level to try and understand the impact of the COVID in terms of the choices of food at the household level. I think this is something that would be interesting. And I can link it to some work that the academia are doing on price dynamics. Some of the research in other countries are showing that for some countries, depending on whether they're deficit countries or deficit areas where food is or availability is often a problem, the COVID pandemic has actually increased prices in those areas even much more, which means if you are a net consumer, or you are somebody who doesn't produce your own food, we can only expect that you are going to reduce your consumption. So the impact might be negative at the consumption level. But there are other places where they produce a lot of food in what we are seeing. And in those ones, you find that the pandemic and the restrictions led to a kind of downward pressure on prices. So there, you would tend to think that probably some consumers have benefited there, okay? But at the same time, you would be worried about the people who are producing, who are in most cases also smallholder farmers. But I think your question is something that colleagues at academia, they would need to see whether they can also embark on such kind of research going forward. I think it's an important question. Okay, Nabu, is there any other new question?
Yes,
Okay.
from Anisette.
From Anisette, okay, let's see.
Yeah, Chiboso.
Okay. Where is the question?
Yeah.
Okay, yeah, please go ahead, Anisette.
I think, I mean, the additional questions I have asked were, part of what I have already said. So what I said here was, kind of suggestion, contribution. If because I was talking about the mean, so I was suggesting that if possible, parametric estimation or modeling may be used in order to get more robust response or estimation. So actually, yeah, my question have been already addressed, I think. But thank you very much for mentioning that.
Fantastic. Thanks very much there. Yeah, Chibozo, thanks very much there.
Yeah, you're welcome.
Okay, so while I'm waiting for another question, because I can't see any question, unless there's another question, but there's one more question that I just feel like I don't want to forget, because and please, presenters, do not think that I'm trying to punish you with questions. The thing is, it's so interesting that I just have to try and see to what extent you can make use of the work in order to really impact on policy. So my questions are directed towards that. Okay, fortunately, you're answering them kind of perfectly. That's fine. So you kind of, is it Paul or is it Joseph or Leonard, in your explanation, in your discussion on one of the questions, you did mention that at the county level, some things might not be tackled there, so it's better to aggregate to something bigger. I think you talked about like a regional block. I like that, because right now we're talking much about regional integration, because we know that as Africa, this is the way to go in order to have a powerful Africa that speaks with one voice. So within the East African community there, do you see a possibility that in future you might do a East African community level vulnerability? So this is really not, it's just like, if you haven't thought about that, it's fine. But if you have thought about that, I would be happy to hear about that. Do you think that it would be useful to do something like that for the East African community in future?
Thanks, Greenwell. We like your question, so don't feel don't feel guilty.
Thank you.
Yeah, I think they are useful. So maybe first before I come to the EAC, which I will also let Joseph speak to a little bit, because there is also a regional learning event that we are planning at the national level. I mentioned that now we have 47 counties. These 47 counties have what we call they have governments. So in Kenya we say we have 48 governments. We have one national government, and then we have 47 governments that are in charge of defined responsibilities by the Constitution. Incidentally, health is one of the devolved functions that counties have to handle, although there is division of work between what counties do and what the national government does. So it is some of the challenges that the country faces, it is very difficult for any one particular county working alone and on its own to address the problem without working in collaboration with other counties. And this already is evident even before this pandemic, because counties have been coming together based on regional aggregation to form the regional economic blocks. For example, the region in the map that we are calling coast, just as it has a regional block called Jumuiya ya Counties Pwani, which is Kiswahili for, I don't know, Federation of the Counties of the Coast Region. And it is because of the realization that individual counties can't deal with certain problems or issues that run across counties. And therefore, there is need to work together to address those issues. So even a disease like COVID, it is very difficult for one county to say, we will lock ourselves and we lock everybody out and we will deal with the problem. You depend on others for food, you depend on others for labor, etc. I mean, there is no one county that is completely independent of the other. And therefore, addressing those issues jointly through a regional approach is very, very important. I think we did mention currently in Kenya, we are having not really a lockdown, but there's restriction of movement for 5 counties that Nairobi and surrounding, I think three or four. Yeah, I think 4, Nakuru, Kiambu, Kajiado, and Machakos. Because those counties are so interrelated. People work in Nairobi during the day. They say, I think during the day, there are about 6 million people in the city. By night, that shrinks to about 3 million because the other people spill into the surrounding counties where they live. Including myself, I live in Kajiado, though I work in Nairobi. And I think it is true for a lot of people. And therefore, you can't address that problem by only locking Nairobi because there will be too much disruption. You have to take a regional approach to address the issue. Using the same analogy, I think regional analysis and approach is also important. And I think not just for the sake of it, because also issues of a disease like this require some regional and international approach. Countries in the EAC trade all the time. So there is movement of people across borders. In fact, that is supposed to happen with minimal restrictions. Trade happens between the countries. Therefore, Kenya cannot effectively control the disease without collaborating with Uganda, Tanzania, Rwanda, and others. And I think when the pandemic came, there was some effort by countries, even the heads of state at the summit level, to try and work together. Of course, countries were not moving at the same pace, or they had slightly different approaches to that. But I think that regional approach is very important because some things can only be addressed if we have a regional approach. We agree as a region, this is how we are going to deal with it. Otherwise, individual countries cannot deal with that. So I think there is desire, Greenwell, to do that analysis, depending on availability of data and other considerations. But Joseph, may I invite you to say something about that regional approach?
Over to you, Joseph.
Can you hear me?
Yes,
No?
please, go ahead.
Okay.
Yes,
oh, okay. No, I think Paul has captured it very well. The issue of regional cooperation certainly has a lot of bearing on this issue of the pandemic. As he has indicated, the pandemic, it's a pandemic, right? So it's going to go across borders and affect many countries across the world. So if you are Kenya, you should be concerned about what's happening in the neighboring countries. So the propensity to be exposed to the spread, is going to be influenced by movement of people, porous borders, and so on and so forth. So certainly that calls for regional cooperation. I think the other issue, of course, is the issue of food security impacts, and there is overwhelming evidence that issues of food availability, for example, become very important from a regional perspective. You need regional markets to stabilize supplies, which is good for producer prices, but also for consumer prices as well. The deficit zones and deficit surplus areas in the region are more varied, different harvesting seasons and so on. So if you restrict markets to local areas, then you're going to have these fluctuations in supplies, gluts, shortages. But if you have regional markets, then you are likely to achieve food security, especially to stabilize supplies and food prices. Something that is only anecdotal at this point, I don't have the data, so don't quote me, is also the capacity to control the pandemic and provide care. And we are seeing movement of those affected by the disease, from different countries going into a particular country that probably can provide better care. So, but don't quote me. Thank you.
Oh, thanks very much, Joseph. And the guys, sorry for going a bit overboard. This is about past, but I think this was worth the time. We have also come towards the end, and I should hand it over to Nab to close it for us.
Thank you, Mr. Chair, and thank you, presenters, for a very exciting webinar, and thank you for all who has taken the time to join us. We would also like to remind you that you can subscribe to our newsletter, and get all updates about the upcoming webinars. We will be having a webinar in May, and we will be pleased to have you there. So thank you again, everyone, and looking forward to having you at the next event. Over to you.
Thank you
very much.
Bye-bye.
Thank you, Nabu, everybody.
Thank you.
Bye-bye.
Bye.
Thank you.
Good job,
Bye-bye.
guys.
Thanks.
Thank you, Mr. Chairman.